I've spent the past 3 weeks cleaning and doing home repairs, so this next segment is going to come to you from my bed. I'm going to talk about cost shifting. Late last year, Senator Max Baucus's staff released a report on healthcare reform, and one of the things they took issue with was something called cost shifting or free riding. And this is where people without insurance shift costs to people who do have insurance. There's no doubt this happens. In Austin, Texas, a small group of homeless people, drug addicts, and mentally ill, talking about 9 people, visited emergency rooms in that area 2,700 times in about a 5-year period. It cost the taxpayers about $3 million. But if Baucus's staff wants to know why that sort of cost shifting goes on, they need to check the legislative history, specifically the Emergency Medical Treatment and Active Labor Act of 1985, which requires any hospital in a government program, that would be just about all of them, to provide emergency treatment regardless of legal status, citizenship, or ability to pay. They also might want to question why enrollees in Medicaid, yet another creation of Congress, are always showing up at the emergency room, and that would be because they can't get service from doctors who don't want to provide the below-cost, government-set reimbursement rate for services. But there's cost shifting that Baucus's staff doesn't see. And I'm not talking about from uninsured to insured, but from insured to uninsured. Hospitals and doctors frequently charge the uninsured hired rates because there's no corporate biggie to beat the rates down. I saw that in my own case when I was insured in the individual market. I got stung by a bee and started to look like a bougainvillea, so I went to the emergency room. The bill I got from the hospital was about $2,000. Then the insurance company I had reminded the hospital that, oh yeah, she did have insurance. I got a replacement bill for about half that. It is no secret that private insurance companies are setting reimbursements pegged on the below-cost, below-market Medicare rate. And there was a study in 2006 that found that every time the government reduced reimbursement rates for Medicare, the private rates went up about 12%, meaning those costs were just getting moved from the government sector to the private sector. So once again, you have Congress, with respect to the current healthcare reform discussion, doing the wrong thing for the wrong reason.